Bismillahirrahmanirrahim. ठीक है. Question number 1. A 70-year-old woman presents with sudden onset of right side hemiplegia and expressive dysphagia. She otherwise well and has normal blood pressure on examination. Emergency, she scans for a small subcortical acute hemorrhage in the inferior posterior left frontal lobe. Elsewhere throughout the brain there are small acute and subacute hemorrhages in the subcortex and background lacunar infarction. There is also marked brain atrophy in excess of that expected for the patient's age. Here is consistent with diffuse recurrence of encephalopathy also seen. Most likely underlying pathology, coagulation, neuroamyloidosis. ठीक है. Now this memorized that the patient had turn on the right side hemiplegia and excessive dysphagia. Then she also has small acute and subacute hemorrhages in subcortex and background lacunar infarction. This is also important. Okay, hemiplegia and excessive dysphagia. And then marked brain atrophy in excess of that person's age. So brain atrophy also three important hints and consistent with diffuse leukocytic encephalopathy also seen. So these are all hints. All these together make neuroamyloidosis most likely diagnosis. Correct? There is no other simple way. Question number 2. Which structures abnormal or absent in all forms of hormonal prosencephaly and therefore the most sensitive indicator of a midline cavity abnormality? Septum pellucidum. In all forms of hormonal prosencephaly, there is absent septum pellucidum. Septum pellucidum absent in all forms of hormonal prosencephaly. Question number 3. Which imaging feature favors diagnosis of toxoplasmosis rather than primary CMS lymphoma? Hypovascularity on MR perfusion study. Which imaging feature suggests diagnosis of toxoplasmosis rather than primary CNS lymphoma? Hypovascularity on MR perfusion study. For CD perfusion, to entire involved arterial trajectory bone recovery, the following options represent the most likely combination of cerebral blood flow between transit time and cerebral blood volume, respectively seen within the affected brain parenchyma compared with unaffected parenchyma. Decrease, decrease, decrease. These can perfusion show entire involved arterial trajectory bone recovery. The following options represent the most likely combination of cerebral blood flow between transit time and cerebral blood volume, respectively seen within the affected brain parenchyma compared with unaffected parenchyma. Decrease, increase, and increase. Cerebral, when there's infarction beyond recovery, then cerebral blood flow is decreased, means transit time is increased, and cerebral blood volume is decreased. 55. Diagnosis of acute disseminated encephalomyelitis. Which adrenal feature finding is associated with the most fulminant course of this disease with a median survival of only 6 days? Areas of petechial hemorrhage. Diagnosis of acute MCQs encephalitis. Adrenal finding most fulminant associated with the most fulminant course of the disease is areas of petechial hemorrhage. Question number 6. Which of the following conditions will typically demonstrate unrestricted diffusion on MR, DWI, and ADC map glioblastoma multiforme? Because it has necrotic cells, so it will have unrestricted diffusion. Which of the following conditions will typically demonstrate unrestricted diffusion on MR, DWI, and ADC map glioblastoma multiforme? Because it has necrotic cells. The 7 of the following findings will be suggestive of an internal carotid artery stenosis of 70%. Ratio of peak suicide velocity in internal common carotid arteries of 4. The following finding will be suggestive on internal carotid artery stenosis of 70%. The ratio of peak systolic velocity in internal common carotid arteries of 4. Question 8. MRI of the brain shows subdural hematoma of the high signal intensity on T1 weighted imaging and of high signal intensity with a hyperintense rim on T2 weighted images. Most likely age of the hematoma 1 week to 7 months. MRI of the brain shows subdural hematoma of high signal intensity on T1 weighted images and of high signal intensity with a hyperintense rim on T2 weighted images. Most likely age of the hematoma is 1 week to 7 months. When there is a high signal intensity with a hyperintense rim on T2W, hyperintense rim means 1 week to 7 months. Number 9. Man undergoing aortic valve replacement. Now, left side weakness is observed. CT shows hypertensity of adrenaline value of -30 HU in the first segment of the right middle cerebral artery. The following option is the most likely to explain the presence of neurology. Right middle cerebral artery fat embolism. Man undergoes aortic valve replacement. Now, left side weakness is observed. CT shows hypertensity of adrenaline value of -30 HU in the first segment of the right middle cerebral artery. The following option is most likely to explain the patient's abnormal neurology. Right middle cerebral artery fat embolism. The aneurysm, anterior communicating artery aneurysm, anterior cerebral artery aneurysm, anterior communicating artery aneurysm, middle cerebral artery aneurysm, internal cerebral artery aneurysm, posterior communicating artery aneurysm, and tip or basilar artery aneurysm. They're all aneurysms. Okay, they again middle cerebral artery infarction. Dense MCS sign is seen on DWI and ADC. MC middle cerebral artery infarction. Okay, question number 10. Enlarge left fourth lymph node of the neck. The point most likely side of the primary malignancy glands. Enlarge left fourth lymph node of the neck, most likely side of primary malignancy glands. Question 11, sorry. Degenerative spinal vertebral body. Temperature change as seen on MRI may have the following appearances. Type 2, high T1 and high T2 signals. Okay. Degenerative spinal vertebral body and plate changes are seen on MRI with the appearances of high T1 and high T2 signal. Because T2 signal is high because of edema, and T1 signal is high because of T1 should be increase of high blood porous fat, etc. So type 2 high T1 and high T2 is seen on MRI findings of degenerative spinal vertebral body change. Number 12. MRI shows mild atrophy of the cerebellum, much more marked cervical measures the junction thinning when decreased and your posterior diameter of upper cervical spinal cord, which returns normal signals most likely diagnosed by ataxia. MRI shows mild atrophy of the cerebellum and much more marked cervical medullary junction thinning with decreased anterior posterior diameter of upper cervical spinal cord, which diagnosed prior to ataxia. There is mild atrophy of the cerebellum and much more marked cervical medullary junction thinning with thin upper cervical cord, diagnosed prior to ataxia. 13. Which of the typical appearance of a pituitary microadenoma early contrast enhanced T1 MR images? Focus of hyperintensity with non-enhancing gland. Pituitary microadenoma is seen on contrast enhanced T1W MR images. Focus of hyperintensity within non-enhancing gland. Focus of hyperintensity within non-enhancing gland is typical appearances of pituitary microadenoma early contrast enhanced T1W MR images. 14. MRI shows a large lesion arising from the posterior elements of the C2 and comprising multiple cysts with fluid level. The variation of vertebral body most likely diagnosed aneurysmal bone cyst. The aneurysmal bone cyst is a giant cell tumor. So MRI shows large lesion arising from the posterior elements of C2. Okay. The thing is that this is osteoblastoma, which arises from the posterior elements of vertebral body. But we will use this figure to explain this, that on MRI there is large lesion and for posterior elements of C2 spinal cord comprising multiple cysts with fluid levels with preservation of the vertebral body most likely diagnosed aneurysmal bone cyst. Question 15. MRI shows thickening of the basal leptomeninges with enhanced with intravenous gadolinium. Abnormal areas are identified in the pituitary gland and optic and facial nerve, which all return low signal on T1 with images and high signal on clear images, most likely diagnosed neuropsychoidosis. Now, neuropsychoidosis is these two are neuropsychoidosis. This is herpes simplex papillaritis. MRI shows thickening of the basal leptomeninges, which are enhancing with intravenous gadolinium. Abnormal areas are identified in the pituitary gland and optic and facial nerve, which all return low signal on T1 with images and high signal on clear images, most likely diagnosed neuropsychoidosis. Neuropsychoidosis always involves the optic nerves. Question number 16. Which of the following period would suggest an ependymoma rather than demyelination, expansion of the cord? Shrink the ependymoma. Which period will suggest ependymoma rather than demyelination, expansion of the cord? 17. Which of the following imaging features favors an intraaxial rather than extraaxial location, expansion of the cortex of the brain? Intraaxial rather than extraaxial location is featured by expansion of the cortex of the brain. Intraaxial extraaxial location is seen by expansion of the cortex of the brain. 18. Which of the following period would favor diagnosis of meningioma rather than vestibular schwannoma, presence of dural tails? The vestibular schwannoma, the meningioma has presence of dural tail. Which feature would favor diagnosis of meningioma rather than vestibular schwannoma, presence of dural tail? Question 19. CT scans with multiple well-defined round and related masses of varying sizes in both hemispheres of the gray white matter junction. The masses demonstrate intense and stable falling tremendous contrast, and there is considerable surrounding edema. Most appropriate next imaging investigation. Just figure it out. CT scans with multiple well-defined round and related masses of varying sizes in both hemispheres at the gray white matter junction. These masses demonstrate intense enhanced falling tremendous contrast, and there is considerable surrounding edema. Most appropriate next imaging investigation. Just figure it out. Okay. Multiple well-defined rounded related masses of varying sizes in both hemispheres of the gray white matter junction. They demonstrate intense enhanced falling tremendous contrast. Considerable surrounding edema. Most appropriate next imaging investigation. Just figure it out.